Hello viewers, so today I am back with an awareness video and today is World MS Day. MS stands for Multiple Sclerosis. So what is World MS Day? It is celebrated every year on the May 30th to create awareness about the disease, and today we'll discuss about this disease. So the multiple sclerosis is a disease which is a demyelinating disorder affecting optic nerves, brain and the spinal cord. So it is an autoimmune disease, which means the person produces antibodies within his or her own body which attacks the own nervous system. So the source of the disease is inside the body. It is not external factors like say infections or injuries. Genetic factors may play a role in a small proportion. The second question is whether this disease occurs in India or not, or it is only a disease of the West. So in the early 60s and 70s, there are not too many patients of MS, and so we used to think it is a disease of the West. But from the 90s, in the last 3 decades to be precise, we have seen many patients of MS in India also, especially when the MRIs scans came to India. The diagnosis is much more common, and so we know that it is a disease of which occurs very well commonly in India also. How about the gender? The women are more affected than men, so almost say two-thirds or three-fourths of all patients are women. And the age group, it is a disease of younger population. So MS is a disease that occurs mostly between the ages of 15 to 60 years. Most commonly in the second and third decades, the onset of symptoms occur. And also, as the word suggests, multiple, it means patients can have multiple parts of brain and spinal cord and optic nerve affected, and also they can have multiple episodes. So symptoms can occur, they can get better with treatment or without treatment, and then after a gap of few months or few years, another attack can happen. So that is the nature of this disease. And to make a diagnosis, first is to ascertain that patients have multiple episodes affecting the nervous system, whether it's a loss of vision or whether it is tingling or numbness on one side, weakness of one side of the body, or imbalance while walking. Some people can have involvement of bladder also, and very rarely other symptoms like memory impairment, seizures or depressive symptoms can also occur. So when people have these kind of symptoms, especially when they occur suddenly and then they peak and then they get better and they have repeated episodes, then the MRI of the brain and spinal cord can help us diagnose MS, which are clearly we see white or demyelinating plaques in the nervous system. And other ancillary tests like lumbar puncture and evoked potential studies may also be required. We also need to exclude other conditions that can mimic MS. And once the diagnosis is made, how do we treat? So treatment is for the acute episodes by giving a 5-day course of intravenous steroid injection, and then the most important thing is to prevent further episodes. So for that we have various options available. There are oral drugs, injections which are available, which need to be taken for long time to prevent future episodes. Then the next question comes is MS curable? For that, one word answer is no. It's a chronic disease, and patients who suffer, they need to take long-term treatment. But there could be a group of patients who have benign MS and they can expect a cure also. That your neurologist can help you decipher whether you fit into the category or not. And then one more question we commonly see is whether women who have MS, can they marry and can they get pregnant or not? So today we have safe medicines that can be used during pregnancy, and also it is heartening to note that the MS relapses are lesser during pregnancy. But still, if women who require medications, now there are safer medicines available which can be taken during pregnancy. So discuss with your neurologist regarding this option also. So now finally my take home message is that the theme for the MS day is connections. So people with MS did not suffer alone in silence. You need to connect with your family, friends, caregivers, healthcare professionals and other patients who have MS, and then share your problems and discuss the treatment options. Listen to the success stories or the achievements or the benefits which other patients have had. If you have felt better, share your own success stories. Let others also know that MS is a disease which one can win over, and there is no need to suffer silently with this disease. There is a lot of hope. Medicines also have become much more cheaper and economical, and many people can afford those treatments, which was not the case say 15 or 20 years back. So all around there are good news, easy to diagnose, easy to treat, and it is like any other disease. So I hope you learned something new from this video. Please like and share, and also subscribe to my channel to watch similar more educative videos in the future. Thank you.